Good evening, and thank you for joining us for What's Next? Strategies for Millennial and Working Caregivers, brought to you by the Benjamin Rose Institute on Aging Young Professional Council. This evening's webinar will be recorded. We will be sharing the link with all of you in an email in the next couple of days. Please feel free to share that with colleagues, family, and friends who could not be with us today. We have a lot of information to cover in the next hour, so we will hold questions until after all panelists have presented. However, you may submit a question at any time using the control panel marked Q&A on the right-hand side of your screen. And I will pass it over to Stephanie Barbie, Chair of the Young Professional Council Program Committee, to introduce today's webinar topic. Stephanie?
Hi, everybody. Welcome. Thank you for joining us for the first of what we hope will be many Young Professional Council Program Committee events. Today's session will be a panel format, and we will address managing work and caregiving responsibilities, caring from a distance, and benefits of enrollment, three topics that we know are of great importance to many caregivers, families. Before we get started, I would like to introduce Dr. Catherine Bryan. Katie is a financial planner and director of training and development for Skylight Financial Group, and she serves as a member of the Benjamin Rose Institute on Aging Board of Directors. She is also the co-chair of the Institutional Advancement Committee and president of the Young Professional Council. Please welcome Katie.
Katie, you're muted.
Of course. Thank you. Thanks, Stephanie, and welcome, everyone. The Benjamin Rose Institute on Aging Young Professionals Council is made up of 15 professionals in the Cleveland area, representing a wide array of for-profit and nonprofit organizations who are really passionate about aging and caregiving issues. We started our Young Professional Council in January of this year, and we are actively recruiting for 2021. So if you are interested in joining us, please visit www.benrose.org/YPC for more information and to complete our online application. I now want to introduce Julie Hayes, who is a content manager under the Consumer Information Initiative at Benjamin Rose. In this role, she oversees the development of both promotional and non-promotional content for the organization's website and editorial partnerships, and serves as an analytic manager for the Benjamin Rose website. Today, Julie will discuss millennial and working caregiver statistics. So please welcome Julie.
Julie, you're muted.
Thanks. Thank you, Katie. So over the past decade, millennials have been made the butt of jokes by the media and even the generations older than them for the perception surrounding them of being lazy, self-absorbed, and unaccustomed to real responsibility. No one knows more than working millennial caregivers just how inaccurate this perception is. Millennials represent about 10 million of the 40 million unpaid caregivers in the U.S., a number that is expected to sharply increase as the population of older adults over the age of 65 over the next generation. According to AARP, older adults, or 35% of these millennial caregivers are ages 19 to 24, 34% are ages 30 to 34, and 31% are ages 25 to 29. 47% of millennial caregivers are male, which is a 10% increase from previous generations. So the same report also details some of the financial characteristics of millennial caregivers. 73% are employed or have at least a job, and 54% earn at or below $50,000 annually, with 11% earning under $15,000. On average, 27% of a millennial caregiver's out-of-pocket income is dedicated to caregiving expenses. So balancing work with caregiving is a struggle most caregivers contend with, but the problem can become even greater for millennials, many of whom are only just getting started in the workforce and are still seeking to establish themselves professionally. Job uncertainty makes millennials even more unlikely to discuss their needs with their employers. So according to AARP, while 60% of older caregivers inform their bosses and supervisors of their caregiver role, only 46% of millennial caregivers do the same. So however, their caregiver responsibilities greatly affect their work, whether they inform their supervisors or not. Around 39% of millennial caregivers arrive to work late or have to leave early due to their caregiver responsibilities. And 14% have to reduce their work hours entirely. So if employers are unaware of the reasons behind their employees' absenteeism, this may also lead to severe warnings, cuts to salaries, demotions, or even termination. So the stress of facing these possible consequences in the workplace can pile up and contribute to a millennial caregiver's sense of burnout, depression, and it also negatively impacts their work performance and productivity. So however grim these statistics may seem, the true thing they show is that this subset of caregivers need support in order to continue doing the amazing work they do. Many policies and supports are designed with the image of a typical caregiver in mind, usually an older woman who has been in her job for a long period of time. And we don't necessarily provide solutions to student caregivers trying to earn their degree or opted fund or respite care accessible to younger adults. So in our presentation today, we hope to offer some solutions and guidance to face these challenges head on. So I will turn it back to Katie to introduce our next speaker.
Thank you, Julie. Those are always astounding and amazing statistics to hear, and no matter how many times I hear them, I just think that millennials really do need more support, and that we need to give them a little bit more props in regards to all the things that they do. So to help us with that will be Lisa Weitzman. She's going to talk about managing work and caregiving responsibilities. Lisa Weitzman is the We Care Administrator and Manager of Business Development at Benjamin Rose. She oversees the development of strategic partnerships to drive the delivery of We Care through Elder Care Services Institutes, LLC. As a master trainer, she also supervises the care consultation working directly for ESI. Please welcome Lisa.
Thank you so much, Katie, and welcome to everybody. Thank you for joining. So next slide, please. So for many of you, you might be thinking, well, I'm not really a family caregiver. I help my mom out, or I do something for my grandma, but I don't deserve that title. So take a moment and step back and think for a second. Do you help an older adult with any of the following? Doing some grocery shopping, running errands, maybe taking somebody to the doctor, coordinating care. Next slide, please. If you checked just one of those boxes, the answer is yes, you are a family caregiver. You may also be a child, a grandchild, a niece, a nephew, a friend, but you're also playing that incredibly important role of being the family caregiver. It's a role that's important, it's hard, and something you should be very proud of as well. Next slide, please. But it's kind of interesting to think about it. Like, did you choose this role? Are you simply stepping up because the work needs to be done? Or do you see this as the role you are supposed to play in your family? Next slide, please. So while we think, oh, it's so great, I'm helping to take care of grandma, or I'm helping my mom out, and this is supposed to be so fulfilling, the reality of the matter is that this can be extraordinarily challenging work. Let's think for a minute, and we're talking about caregiving now for an older adult, not for a child. We think, for instance, that we see mom and dad or grandma and grandpa growing old. And so we say to them, you know what? I think it would be really challenging for you to be living in your home now. Why don't you move in with me? And we offer this opportunity to our loved ones from the bottom of our heart because we love them unconditionally and we want to be able to care and take care of them. They don't necessarily hear it that way. They hear us saying, you don't think I can swing this anymore on my own. So we're offering them this incredible gift, and they're holding us accountable for their loss of autonomy. And at the same time, we may be thinking, I don't really want to be caring for anybody else right now. I'm just starting out in a new job. I have a new relationship. Maybe I've bought a new home. And now I'm saddled, so to speak, with the care of my older loved ones. So They hold us accountable for their loss of autonomy, and at the same time, we may hold them accountable for our own loss of freedom. They also wonder, how in the world do you know what's best for me? I raised you, and you have no idea what it is like to be my age. They're in denial about their aging, and we're concerned about it. They want to be independent, and we want nothing more than to help them. And at the end of the day, the thing that makes this caregiving situation even more challenging is that we continue to seek approval particularly from our parents, and replay old patterns from our childhood rather than risk rejection. So we're continuing to play out all that we need from them, and at the same time, they're trying to seek that level of approval from us. Next slide, please. So there's all these challenges happening on the emotional side, right? That doesn't have to do with what we're actually doing for them. That's just why it's so challenging from a psychological perspective. Now let's think about what happens when we blend it with our job. On average, millennials spend 21 to 24 hours a week as a caregiver. That is really a whole nother part-time job. On top of for many people, what is a full-time job? So in order to balance it, we use our sick time, we use our personal time, we use our vacation time. And now suddenly any time for ourselves has been eaten away by our other part-time job. It affects our ability to work, which means that it might limit the income that we're bringing in now if we have to take unpaid time. And there's this general fear in the workplace that if my boss finds out that I'm a caregiver, I'm not going to be seen as all in, and I will be passed over for promotions. I won't be eligible for that next pay raise or what have you. So I'm not going to talk about it, which means I'm not going to get the support that I need. And I tend to think I'm very alone in doing all of this. I'm so young. There's nobody else in my role. And that, of course, doesn't help our ability to perform well in the workplace either. Next slide, please. And as if this is not enough, we have COVID. And like with everything else that we do, COVID in many ways equals chaos for caregivers, as it does in so many other areas of our life. We're trying to manage work. Now suddenly the day center or the caregivers who used to come and take care of mom and dad, grandma and grandpa, aren't able to come anymore, or the centers aren't open. So now we need to figure out what we're going to do with our older loved ones during the day while we're managing work, oftentimes under the same roof. And for many people, we're also doing homeschooling with our children. And somehow we're supposed to perform our job. COVID has made it much harder to find affordable services, and everything just seems to be harder. Navigating the paperwork, paying for services, keeping our loved ones safe. And oh my gosh, what about our own needs in all of this? Next slide, please. So it leaves us, for many of us, feeling extraordinarily overwhelmed. I think this quote captures it so well. Caregiving can suck you into a swamp of anxiety, guilt, and resentment. We never feel like we're doing enough. We're aggravated that we have to be doing it. We're worried we're not doing it correctly. And we really feel like we're not meeting anybody's needs really well. We're too busy for friends. We're impatient with our loved ones. We can't focus on our job. We're exhausted. And for many people, we're constantly fighting illnesses. Next slide, please. So it leaves us, as I said, with a lot of conflicting emotions around this whole caregiving journey. And I promise you, this is the last Debbie Downer slide. Next slide, please. So it is good to know that you are not alone. Julie went over a lot of these statistics before, so we don't need to revisit them all now. But look at those numbers. Look how high they are for millennial. These are not caregiver numbers, but these are millennial caregiver numbers. There are so many of us that are in this role, but many of us just don't talk about it, and so we don't know that there's a whole community out there experiencing the same thing that we are. Next slide, please. So what can we do? So we can go back to the basics and say, oh, we need to take care of ourselves, and we need to diet, eat the right diet, we need to get enough sleep, we need to get enough exercise. But let's face it, we've all heard those lines and those mantras over and over. And when we're feeling overwhelmed, it's really hard to find time to carve that out. But what can we really do now to try to relieve some of that stress, some of that burden, and that anxiety? One, and I think the theme of all of these points is making sure that you establish boundaries and take care of yourself through all of this. So that comes by having honest, respectful conversations with your older loved ones, letting them know this is what I can do and this is what I cannot do. And understanding for yourself that establishing boundaries is okay. It is okay to say no. You're not going to hurt them. And oftentimes no means you can't do it personally, but let's find another solution in the community that's more sustainable. Figure out what you have to do and see if you can't let go of the rest. And part of that then becomes, how do you engage with local community services? For many of us, we don't really know how to engage community-based organizations in our care and keeping. We've never really had to. We haven't seen anybody else engage with them. And it's not really until we become caregivers that we have to figure out, how do I access all of the resources that are in my community? Next slide, please. So as part of that, it's really helpful to think about building your care team and thinking about who is going to be on that team. Your older loved ones should be members of that team. Your siblings, figuring out who is actually going to do what. So that oftentimes there's one sibling who tends to take the lead and run with it. And oftentimes that means that the rest of the siblings kind of tend to step back and watch it play out. And the reality is that there's room for everybody. If you're local, if you're long distance, there's always things people can do to help that primary caregiver out. And focus really on that shared decision making. And as you do it, it's so critically important to understand the finances of all that's involved. Next slide, please. So you've got your care team at home and you know who's on that team. What can you do with your job? One great thing to do is to advocate with your boss or with your HR department. Have a sense of what benefits would best meet your needs. Would it be helpful for you to have paid leave? Would it be helpful for you to have flexible work arrangements? Many times, we think back pre-COVID, people thought, oh, if I could just work at home. Now I think many of us are ready to say, oh my gosh, if I could just work in my office. But think about, what is the best work arrangement for you, given all that you're juggling? Would it be helpful to have some type of financial support services? Do you need access to resources? Or even connections to caregiver support programs like We Care Because You Do, which is the caregiver support program at Benjamin Rose. Next slide, please. So what is We Care Because You Do? In a nutshell, We Care is a telephone and email-based support program for family and friend caregivers and their loved ones. This has always been delivered via email and telephone. It is not just a COVID response program. It's actually a program that was developed by the Benjamin Rose Institute on Aging about 25 years ago. And within the last year and a half, we've started to deliver it as a program of Benjamin Rose. So we have 4 goals as part of We Care Because You Do. One is to connect people to the resources they need to make good decisions. Now, sometimes that means helping people to understand a diagnosis. Sometimes it means understanding why someone may be acting the way they are based on their diagnosis. Sometimes it's about, how do I have a really challenging conversation and I just don't even know where to start? We say to you, we could get so used to the fact that we could just Google whatever information we need. And I always like to remind people, when my son was 10 years old, I went into his room and he was on his computer and I innocently enough asked him, hey, bud, what are you doing? And he said, oh, Mom, I'm answering Yahoo questions. I love to do this. So I then asked, well, what questions are you answering? Remind you, he's 10 years old. And he said to me, rather disdainfully, I only answer the medical questions. Now imagine who's on the other side of that. He was well-intentioned, but he was 10. He didn't know a thing about medicine. And somebody might have actually was looking for some information to make a really important life decision, pulled up whatever answer he had typed in there, and made some critical decision for themselves based on his advice. So I take that as warning. First of all, rest assured, he's no longer doing Yahoo questions or Yahoo answers. He's moved on to Wikipedia pages. So that may give you some relief. But the reality of the matter is, and in all seriousness, That's why it's important to get information from someplace that you trust. And that's the advantage of getting information from a place like Benjamin Rose, which has a research organization and prides itself on the quality of information that we deliver. The next thing that we do is help people to connect to community programs and services. And then we really help you to build that care team, to understand how you can best take care of you and best take care of your family. We want to help people go from crisis to really helping them to plan for the future. It's a program that we deliver at no cost to anybody who has a footprint in Cuyahoga County. And we like to ask the people are in the program for about 3 months at a time. We find that gives us the best way to really get an understanding of what's happening in a family situation and to really help families come up with plans for how they're going to progress through it. When you're in our program, you work with the same person for the entire time. So it's not like a 1-800 number where you call for a referral and you get somebody and the next time you start your story all over again. It's about you and that care consultant who becomes really a member of your care team. And in this way, we provide you with the tangible support and the emotional support that you need all along your caregiving journey. So thank you for your time. I look forward to answering your questions, and I will pass it back to Katie.
Katie, you're muted.
I'll say thank you so much, Lisa. I know that a lot of our millennial caregivers will hopefully look into that We Cares program. And we all know that just with COVID and everything else, just hearing about all the statistics is overwhelming in itself, let alone if you're living it on a day-to-day basis. So please reach out for any kind of help to Benjamin Rose Institute on Aging. We know that a lot of caregivers are not just caregiving for their family members here in their own hometown, but may have family or people that they love that they're caregiving from a distance. So our next speaker, Dr. Sarah Powers, who is a research scientist in the Center for Research and Education at Benjamin Rose. In her role, she does a wide variety of research and evaluation projects focused on bettering the lives of older adults and caregivers. Please welcome Sarah.
Hi, everyone, and thank you so much, Katie, and welcome everybody, and thanks for joining us tonight to discuss these really incredibly important topics. So as Katie mentioned, I'm going to be talking about long-distance caregiving. Lisa did a great job of talking about how work fits in to our lives as millennial caregivers. I actually identify as a millennial caregiver myself and also a long-distance caregiver. So I'll be talking both from a professional and a personal kind of experience. I've been working and teaching in the field of aging for over 10 years now and have found myself in a long-distance caregiving role for a variety of reasons. So you may find yourself, traditionally, long-distance caregivers have been considered somebody that lives farther away from your loved one, and typically that cutoff is 60 minutes or more. And that distance may interfere with the care that you wish and hope to provide to that person. Unfortunately, with the pandemic, many caregivers that were once local or close by, my in-laws live right across the street, but now we still consider ourselves long-distance caregivers because of all of the choices we've had to make because of physical distancing and not being able to provide care as best as we can. So over the next couple of slides, I'm going to offer some tips and tricks that may help you with framing your caring from a distance into a more manageable partnership with those that you love. Okay. Thank you for switching the slides. So now that everything has moved to a virtual platform, the silver lining of the pandemic is that there's been a wide variety and availability of programming to do things online and remotely for those that we care for. One way that I've been able to help out my dad who lives in New Jersey, especially when there was a peak in the coronavirus there, it really made him it made it hard for him to be able to safely get groceries. And so there's been an abundance of, ways in which we can order groceries online, have them delivered. We're also able to order curbside pickup for meals. A lot of times, caregivers that are in a long distance role find themselves contributing financially. So being able to even facilitate paying bills online, talking to medical providers and the medical team that helps with your loved one's care via the phone or using a lot of interactive platforms that healthcare systems have now developed is really is beneficial in providing care from afar. Another recommendation is to coordinate care early on in the process. You may not identify as a caregiver now, but guaranteed, more times than not, we are going to find ourselves in that role. So planning ahead really is very important in this process. So depending on the type of condition or conditions that your loved one may be, experiencing and their level of independence, whether they are able to live independently within their own home or in any variety of assisted care facilities, it's incredibly important to delegate these tasks whenever you're able, to give you peace of mind that when you're not able to be there because of the distance. And like I mentioned many times, the literature and research on long-distance caregiving finds that these types of caregivers, especially those that live even farther away or maybe across the country, tend to feel obligated to provide financial support to their loved ones. And this may not be feasible for a lot of caregivers. So being planful and making the best of your long-distance caregiving journey is incredibly important. That leads to my next suggestion of being proactive instead of reactive. A lot of times we find ourselves in these reactive roles. I don't think anybody could have predicted that a pandemic was going to happen, let alone the surmounting events that have happened in 2020. So having a plan in place in case of an emergency or emergency arises is essential for long-distance caregiving, just in case you cannot be there in time or can't get on a flight or can't get in the car to help facilitate with that emergency. And that emergency may be anything from a power outage to a hurricane, to wildfires, to a medical emergency. And it's just really important to have all of your loved one's important documents in order, such as medical information, a list of medications that they're currently on, or any type of emergency supplies, whether that's just having them know that there's a stash of batteries and flashlights in a closet somewhere, and also developing an evacuation plan as well. So knowing where they're going to go in case this happens. Also having copies of living wills, health insurance information cards, emergency contacts, keeping that in a binder, or for those that may be in a flood zone, having that in some type of waterproof case that's easily accessible can be really important to have on hand when you can't be there. You may even want to try out a personal health record app that you can download on an iPhone or Android or tablet that family and friends can download as well, so you can help coordinate that care. But it can also have your loved one's information in one spot to help keep track of appointments and medical or medication refills. Next slide, please. So, previous slide, thank you. So some other things that help can facilitate and make caring from a distance a little bit easier is really trying to figure out how to make the most of your visits. When my mom was going through chemotherapy and radiation treatments, it seemed overwhelming because I wanted to do everything in a weekend for her, whether that was meal prepping, going to appointments with her, cleaning the house. And I realized very early on that I wasn't able to get everything I wanted to do while I was living in Ohio and she was in New Jersey done in a long weekend that I was able to get back there. So when you're not planning for emergencies, it's incredibly important to make the most of your time with your loved one. And that also includes spending, really good quality time with them. Long distance caregiving can seem very overwhelming when you may only have a long weekend to spend with them, or your travel time is 3 hours there and back. So try to pick manageable tasks to accomplish, such as putting grab bars if your loved one has a high risk of falling, putting grab bars in the bathroom if they have a hard time getting up and down from the toilet or recliner. If they are fallers, try to eliminate things in their environment that may pose an issue or lead to them tripping. Or just simply, being able to go grocery shopping with them. But again, with the pandemic, everything is that much more complicated. So it's good to kind of be mindful of how you'll spend your time and have realistic expectations of that. Another thing that may be very hard for families, especially when caring from a distance, is having conversations about end-of-life wishes or advanced care planning and directives. So try to really space out those heavy hitter conversations as best as you can. Try to approach these conversations in a planful way. It's much easier for your loved one to know that you are planning to talk about these things with them than to try and spring it on them. What works best is to try and find a natural way in your normal conversation, whether that's through a FaceTime call or on the phone or text, to understand your loved one's preferences for care. My family always had these conversations over food. Everybody was always in a much more relaxed mood and felt a little bit more comfortable with mashed potatoes or a cheesesteak in front of them when talking about death and dying. And it made it a little bit more palatable to be able to discuss these incredibly important, very heavy-hitting conversations, especially while living afar. When we were able to get together, we tried to really kind of plan things and know what our loved ones' expectations were, should we not be able to get there in time or an emergency would come up. As always, try to take it one day at a time and recognize when you're feeling burnout, whether that's due to the stress or the distance standing between you and your loved one's care. Make sure you reach out when you can. It's amazing how fast the community can come together to respond to someone reaching out for help. And always be on the lookout for virtual caregiving programs. There are many that are now popping up as the pandemic continues to press on. A lot of agencies and community organizations are switching their programming and outreach efforts to a virtual platform. And a lot of them are also developing programs and really kind of insightful webinars just like this, offering insight into how to provide care while living through the pandemic, which I think just adds another layer to the caregiving role and life in general. So when you're managing your loved one's care from afar, it's really, especially when trying to navigate the world of all these incredible restrictions that are placed on doctor appointments or restrictions within the hospital or in a nursing home setting, and trying to navigate that. It's really important to take it one day at a time as life continues to evolve. Next slide, please. So some ways to engage in the time of COVID. In the world of physical distancing, it's hard to stay connected. And now with working at home for some and always being plugged into devices, the internet, it may seem really exhausting at times. And at the end of the day, it's really hard to kind of unwind and unplug when you are staring in front of a screen all day. So some ways in which my family and I stayed engaged with our older relatives, especially my dad, who's currently living alone and not able to travel due to the pandemic. Some activities and things to share with your loved one to make the distance not seem so far, things like a life review, a shared photo album, and other activities to share and discuss. So for example, a life review can be a very fun activity to engage in with family members. And this consists of asking questions about your loved one's life that includes exploring their upbringing, their childhood experiences, their teenage years, any major life milestone, and anything in between. There are programs such as lifebio.org that have developed a program specifically for residents in nursing homes. There are books that you can order from Amazon that guide people through the questions, and you can handwrite everything in the book. And then a simple Google search can provide you a list of questions to work through as well, if you simply Google life review or reminiscent therapy. So my family and I, we've set up weekly conversations that center around these questions, and we kind of work through them, and I write them down, and eventually we can create a book out of these. That includes, pictures, and, it's incredible what you can, a very fun way to learn about your parents, your grandparents, your aunts, your uncles' life, and gain incredible insight into their experiences, as well as get a lot of good advice along the way. Some other things that may help to engage with your loved ones is creating a shared photo album to upload pictures. So this can be done on Apple products, Google, Android products, creating a shared photo album instead of dumping a lot of things onto social media has been a way in which I can share a lot of pictures of my young children with my family. They can view and comment, and it's a way to help keep a level of engagement, even though they haven't been able to see my children in a very long time. Another way is to create virtual book clubs. So identify a book that you both can read, or watch weekly TV shows together, or binge a Netflix show together. And again, keeping in mind obviously where your loved one that you're providing care for from a distance, what level of independence, what their capabilities are, and what they feel comfortable with doing. So, FaceTiming is obviously, those video calls are really, nice to have in scheduling that time. Sending a care package, that's a box of sunshine that includes everything yellow in color, or even sitting down and writing a simple letter, ways that we don't have to use a device, but still, let people know that we're there, and we're trying our best given all of life circumstances. It's a way to stay engaged through these trying times and still provide the best of care to your loved one in the best way that you possibly can. So thank you. That's all I have, and I look forward to answering any questions or comments that you may have at the end of our panel. Thank you.
Excellent. Thank you very much, Dr. Powers. Great information there as well. I want to keep us moving to keep on track. So our next speaker is Amanda Bruton. And as we're caring for caregivers, a lot of times we're also dealing with a lot of the government benefits, Medicare, Medicaid. It's hard enough for our parents to have done it, or grandparents, or people we're taking care of, let alone for us to sit down and understand them. So Amanda Bruton is the owner of Medicare Answers Now. She's been teaching agents and beneficiaries about Medicare and the many options available for over 15 years. She is viewed as one of the top resources within the industry, having worked on several projects, including revising the Medicare New Book. Please welcome Amanda.
Thanks, Katie. Okay, so if you can advance to the first slide, perfect. So what is Medicare and who's eligible for it? Typically tends to be one of the first starting points that we need to talk about. And Medicare is the federal program that is for those that are 65 and older, or if you are on disability, you have to be on disability for 24 months and then to be eligible in most cases. Or if you have end-stage renal disease, that is one of the ways that you can go ahead and become eligible. Typically, that means that you need to be on dialysis for 4 months, and then you become eligible for Medicare. This is different than Medicaid. So Medicaid is available to anyone, whether they're young or old, and it's based on your income level as well as your assets. So there's usually some misunderstanding between the two of those. Next slide. So how do you apply for Medicare? When somebody is turning 65, typically what'll end up happening is that if they're already getting Social Security, then they're going to automatically get their red, white, and blue card in the mail. And it is stereotypically red, white, and blue. You want to, and that's one of those important documents that your loved one wants to hold on to. You want to treat it as important as a Social Security card. In the event that they're not getting their Social Security, then you need to go ahead and apply for Medicare, and you can do that a couple of different ways. Most people nowadays, and especially with COVID, you can do it online. It's a very easy process, and you do that actually through the Social Security website to do that. And you have a window that is to apply, and typically you want to get it done before your 65th birthday. So it's 3 months before that date and the month of. So for example, if I was 65, my birthday is April 3rd. So my Part A and Part B would become effective April 1st. And I have all the way, I can start enrolling or try to apply for Medicare all the way in January. And then I have all the way until the end of July if for some reason I forgot or something else happens. But again, most people tend to go ahead and be on the front end of this. It's one of those big deal birthdays, if you will. So everybody knows you get excited when you turn 16, you have a car. When you turn 18, you get to vote. 21, you get to drink. 40, oh my God, I'm over the hill. And then all of a sudden, when you turn 65, most people know, okay, I have to do something when it comes to the retirement, and this is where you need to go. If you are covered under an employer plan, so you're working or your loved one is continuing to work, I would suggest that they go ahead and they work with either a OSHIP volunteer or a licensed agent that specializes in Medicare. The difference between the two is that the volunteer takes about a 19-hour training, and they're there, they don't get paid. It's just they're there to give information and to advise. A licensed insurance agent takes hours and hours of training annually to go ahead and make sure that they can advise and fit what is in the best interest. Typically, how they get paid is by the insurance carriers. That no money should ever be gone ahead and exchange hands. So please know that. And in the state of Ohio, outbound calls to your beneficiaries are illegal. So if that is happening, let somebody know, but there is not supposed to be any kind of solicitation to your loved one. Another thing to note is Social Security, Medicare, and the IRS do not make phone calls. So you really want to make sure that your loved one knows if anybody that is calling on behalf of those three government entities, that's a scam. Don't give your personal information out. All three make contact via mail. It is not done by phone. So please be aware of that and then contact the police department if that is happening. Flipping back into this, if your client or if your loved one is continuing to work, there are some rules about delaying their Medicare. They can do that if they work for a larger employer, and that is an option. If they're not, then they need to definitely go ahead and get their A and B card. Next slide. So what are the parts of Medicare? This information actually was just updated for the 2021 year and the thresholds. So all of the information on the slide is the most current for, and it will be effective January 1. Part A is for your hospitalization and your skilled nursing facilities. So when you have to go into rehab because you've had a hip replacement or something like that, or the hospice care for end of life, that's covered under your Part A. When you have original Medicare, there is no premium for most people. You get that because of the 40 credit quarters that you or your spouse have worked. But you do have, and Medicare was designed to be give you enough coverage in the event that something happens, but it's not designed to cover and pay for everything. So Part A, if you were to go into the hospital and not have additional coverage in addition to your Medicare, you're looking at a deductible of $1,484. And then, as you can see, the copays that are there. On your Part B, this is the part that is for your doctors and your outpatient services and surgeries, as well as your durable medical equipment like oxygen, wheelchairs, hospital beds, things like that. Typically, this does have a premium on it. For 2021, it is going to increase to $148.50. That is income-based, so the more money that somebody makes, it will go ahead and that will increase. And you do have to go ahead and enroll in Part B when you're eligible, unless you have some qualifying events. If you do not enroll in it when you're first eligible, you can possibly be subject to a 10% penalty for every year that you delay it. There is a deductible on Part B, which is $203 for 2021. The thing with Medicare, original Medicare, is there's no maximum out of pocket, which what that means is that that's the most amount of money that somebody will pay. There isn't one. So you'll see in a couple of slides where we talk about Medicare supplements and Medicare Advantage, which are plans that will help pay for services as well as work with Medicare and coordinate. With those, typically there's a limit to that, and it caps that exposure that you have. Next slide. Can you advance the slide for me? Thanks. Okay, so Part D, as in David, is your prescription drug coverage, and with that, it is only sold by private insurance companies. You can get it one of two ways. First one is with a standalone prescription drug plan. Typically, they run anywhere from $7 for 2021 all the way up to $150. And then some. The other option that you have are through Med Advantage plans, which are referred to as an MAPD. The enrollment for and the eligibility for a Part D plan is the same as when signing up for your Advantage plan. You have 3 months before, the month of, and 3 months after to do your initial enrollment period. And then every annual enrollment, which we're in the middle of right now, which is October 15th to December 7th, that's when you want to go ahead and evaluate your drug costs as well as the medical options that your loved one may have. It is really important that you do that because the prescription drugs and how they are covered, if they are covered, change every January. Your loved one will get information in the mail in September, usually towards the end of the month, advising them of any changes that may be happening for the upcoming year when it comes to Advantage plans and drug plans. Next slide. So what if they can't pay for this? What happens? What programs are out there? How does this all work? 20% of all Medicare eligibles out and Medicare beneficiaries out there actually qualify for what's referred to as extra help or low income subsidy. And the cool thing with this particular program is that one is specific to prescription drug coverage. And it is not pass fail. There's multiple levels of subsidy that someone can qualify for. And in the state of Ohio, if you qualify for extra help, they automatically go ahead and send the information to Ohio Medicaid to see if they will be eligible for Medicaid in addition to the extra help. Medicaid typically is your medical coverage. The extra help is your drug coverage, is how that works. In order to go ahead and find out, and I strongly suggest that if you have somebody who says, you know what, I'm having trouble paying for XYZ, apply for it. Worst case scenario, they come back and they say, no, you're not eligible. Best case, you're able to go ahead and get benefits that you were unaware, that your loved one was unaware of. So you can do that by visiting the Social Security website. You can type in extra help. The website is also on the slide deck, as you can see. You can also call the 800 number, which is there to get a paper application mailed to you or make an appointment at the local office, although I do believe that the local offices are closed due to COVID. I don't believe that they've opened back up. Qualifications, as you can see below, what they're looking at are what you have in the bank and the investments. If you have more, if you're single and it's not more than the $14,610, then you may qualify for one level of that. It's not going to go ahead and count your home or your vehicles, the jewelry under the bed. None of that comes into play. What we're actually looking for is hard cash that you have in the bank and IRAs, investments, things like that. Next slide. So I believe this is the last slide. So how do you help your loved one? The first one, the first bullet point that I have there is that if you need help getting information, everyday questions, you know, you have a question regarding a insurance bill that you got, or you need to order ID cards because you can't find the card that they need to go to the doctor or something like that. Most carriers have what's referred to as a HIPAA form, or you can go ahead and pull the appointment for representative form that CMS has. Those forms can be kept on file with the carriers, so you're not allowed to make any changes to anything that they have, but this will allow you to get information and speak on their behalf and ask questions for them. The next piece that I would recommend that you talk about or look into doing is that there are two forms of what's referred to as a power of attorney. This gives you the ability to make decisions on behalf of your loved one. There's two kinds. The durable power of attorney is the financial one. So that gives you access to banking information, anything that you have to do basically with finances. The medical power of attorney is the one that you would need when you're talking about medical decisions because somebody is incapacitated, or signing up for some type of insurance or making changes to their insurance. Both of these, there's forms online that you can go ahead and download and use, or you can go ahead and speak with an attorney and have them go ahead and help you with that. I would also, and the type of attorney that you're looking for is an elder law attorney typically, because there's a lot of other things that they can help you with when it comes to protecting their assets, working in regard to their insurance, life insurance, and all of that. Am I at my last slide? Nope, one more. Okay, so with this one, it's just basically an overview of the difference between original Medicare, Medicare supplements, and Advantage plans. And I know that we're way over time. With the original Medicare, as I said, basically with this one, with original Medicare, you've got high deductibles every time you go into the hospital of the $1,400 and change. You can go to any network provider or any Medicare provider that accepts Medicare. There is no real network. I believe 95+% of the doctors out there take Medicare, but there is no Part D. You would have to pick up a standalone Part D plan. There's no gym memberships, there's no dental, there's no vision, there's none of those extras that you hear about on TV with any of those ads and stuff. And the only premium that you're paying is the Part B as in Bravo and the D as in David for your drug cost. Medicare supplement, again, you're going to have your Part B premium. You're going to have, this plan actually fills in the holes where Medicare doesn't. With this one, it's your alphabet soup. So typically you'll hear about a Plan F, a Plan G, or a Plan N. With these, again, you have the flexibility to go anywhere that accepts Medicare. You're going to pay a bill for whatever the premium is. You may have a couple of copays, but that's it. Typically for doctors or emergency room. You will need a drug card. You're paying for flexibility on these plans, which is why they're so expensive. With them, if you wanted to change plans, you can do it at any time, but you have medical history that's going to come into play as well. Most offer a gym membership, but you're going to need to have dental and vision from a separate policy on that. But that's typically what a Med Sup is, or Medicare supplement is, or Medigap policy. Med Advantage plans, you have your Part B as in Bravo premium, again, that you would pay. But these are the ones that you see advertised on TV that they can have a zero premium on them, or they can be a little bit more expensive. There is a max out of pocket when it's referred to for your co-pays or co-insurance that you may have for medical stuff. Some of those can be as low as $3,600 for medical costs. Some can be much higher than that, but they can't exceed, I believe it's $11,000 for 2021. The cool thing with Med Advantage plans is that you don't have those premiums, so you're only paying as you go to the doctor or as you go to the hospital. You do need to use network facilities and doctors, but there's no medical history. So you don't have to worry if you're really, really sick, if you're going to be accepted, you're fine. And what you see as a premium, anybody that lives in that county has that premium. So you don't have to worry about that either. And the premiums tend to only go up, if they go up, maybe $1 or $2. It's not any significant change. Plan changes or benefit changes happen every January. Again, that would go ahead, and the time to change is just October 15th to December 7th. These do include dental, vision. Some even cover coverage for over-the-counters items like Depends. There's a carrier out there that will also, in a in one of the previous sessions, someone mentioned senior proofing a home with the bars and the raised toilet seats and the shower seats and everything like that. There are carriers that actually offer assistance to help pay for all of that stuff. So these plans are very, very rich with the different types of benefits that are built into them. And they typically do include dental, vision, as well as a gym membership. So with that, I thank you for the time. If you have any questions, I'm going to turn this over to Katie. Thank you.
Thank you so much, Amanda. I'm going to open it up now to questions. So I'll invite all of our panelists to turn their microphones and their cameras back on. And if you have a question, please feel free to submit it in the Q&A box on the right-hand side of your screen. We do have time for a few questions. One question that has come in, which, I think many others probably are thinking about, it may be, referring to other services, but they're saying that they need help getting a home health aide, and that due to COVID, the agency they've been working with is unable to provide one, and that they've heard that independent providers for HHA could help, and they're wondering how that's done. And more broadly, I'd probably open up to the panel, if people are having trouble accessing services during COVID, what can they do?
I'll take this. CMS stands for Center for Medicare Medicaid Services. They just went ahead and released earlier today that they updated a brochure in regard to home health care and what's covered, how to get coverage, how that all works, and how to work with various organizations to get that kind of care. I can get that to you, or you can find it on the CMS website, but they just published it not even 6 hours ago.
Thank you. Would any of our other panelists like to answer that question too?
I can just jump in and say, so in terms of getting a home health aide in general, I think that no matter what the time is understanding what type of service you want in your home, being prepared to have good interview questions that you're going to ask as you call, working with somebody who can help identify who are those local providers that are still providing services. How do you access them? And then again, are you prepared to have that conversation? What's important to you as a family as you seek to prepare to bring somebody into your home? And then at the same time, how do you work with your loved ones to have them ready to accept help in their home? So I think it's more than just identifying the agency, but it's how do you do all the prep work beforehand to make sure that when that aide walks in the door, it's successful for everybody.
Thank you. We have time for one more question, and I'd like to open this up to all of you. You all presented fantastic information and resources for millennial and working caregivers this evening on a variety of topics. And representing your particular topic, if someone is looking for a first step, what do you recommend they do first, especially if they are new to caregiving for an older loved one, remembering, of course, that everyone's situation is a little bit different? So I guess
can start.
Sure.
So I can start. I would say that the most important thing is to start having a plan, to understand what are your family's goals. What are you looking for from this caregiving journey? What is most important for you to take care of? So, and for everybody, what's most important looks very different. So it's not jumping to making decisions. I think when we find out someone's had a diagnosis or we recognize that we're in that caregiving role, we tend to respond as if we're in a crisis that has to be resolved now. And the problem is that if we try to resolve it right now without good information, then sometimes we're making fast decisions, but not good decisions. And so recognizing that you can take your breath, start to do your research, find somebody who you trust who's been a caregiver, find an organization that you trust who can help play that navigator role for you, and really empower yourself with information so that you can make good decisions all along the way.
Thank you. Sarah or Amanda, would you like to answer that question too from your respective topic areas? What's the first step that a family caregiver can take?
Yeah, hi, sorry. I think especially in the context of long distance caregiving, making sure that everybody's on board and knowing, like, if you have siblings or cousins or whoever is going to be part of that care network, if you can't physically be there on a daily basis or weekly basis or whatever the needs of that person you're trying to provide care for, have that conversation with everybody. Because I think what Lisa brought up and Julie brought up as well is that a lot of times we assume that somebody is just going to naturally take that role, and a lot of times that does because of a lot of cultural expectations. But it's important to include everybody in those conversations starting out that caregiving, or even pre-caregiving. We're all going to eventually become caregivers for somebody, and so it's incredibly important to be prepared for that and come up with a plan, like Lisa mentioned. But I think just involving everybody that could potentially give care to that person, and having whether it's and knowing that it needs to be an ongoing conversation. It's not just a one and done thing. That plan is ever evolving, and people's life circumstances change, especially given the time of the pandemic. And so it's important to not just have that conversation once, but to revisit it when it needs to be revisited.
Thank you.
I would say in regard to Medicare and what their health benefits are, I would have the conversation and have it immediately to find out what they have as far as their insurance goes, and if they have taken the time over the last couple of weeks to go ahead and review their medical coverage for this upcoming year. They've only got less than a month to go ahead and make any changes that they may need for January, to start for January 1. If they haven't done that, contact a local agent to help them look at the information. They can also go ahead and, you want to try to navigate it yourself, knock yourself out. There's over 60, I think there's 60 plans in some of the counties, and Cuyahoga County has 71 Med Advantage plans to sift through. If you want to do that through Medicare.gov and the Plan Finder, by all means, knock yourself out and try it, but I wouldn't recommend that. Work with somebody who's well-versed in the plans and what's out there and all the various benefits. They'll take a look at everything so that way they find the plan that fits. So that would be the first step, and that needs to happen before December 7th.
Thank you so much. And thank you to all of you for being on our panel this evening. And thanks to everyone listening in for joining us for What's Next Strategies for Millennial and Working Caregivers. Please stay tuned for more programming from the Benjamin Rose Young Professional Council in the new year. And for more information on our Young Professional Council, as Katie mentioned earlier, you can visit www.benrose.org/YPC. Thank you and take care, everyone.